Hairstylists, barbers, and dental assistants. We see a lot of things in the mid-back for them because they're always twisted and hunched over, right? So we're always seeing those guys twisted and hunched over, especially in the same position. In the ideal situation, we would be able to train ourselves to use both hands, so we'd be a little bit more focused using the right hand, a little bit more focused on the left hand. We would switch between the two. Most people aren't going to be able to develop that very quickly. Trying to find a way that you can be more square to the situation is the answer on that one as well. So we always want to make sure that we're relatively square into the position when we're working. If we're always hunched over, let's make sure that we take breaks every 30 to 45 minutes. So think like a hairstylist, every haircut, we want to make sure that we're opening everything up. We're going the opposite direction of our consistency to stretch those muscles and strain the system in the opposite direction. So people that are remote workers, working from home, tech workers, or gamers, right? Our situations at home are very rarely a good or optimal situation for ergonomics. If I'm always working on my laptop on my couch, right? So I have my laptop in my lap, leaning back on the couch, I'm definitely gonna get that forward position. I'm gonna see lots of changes in the architecture of the muscles, the ligaments, and the connective tissue in my upper back to accommodate for that. Right? So our body's gonna make that adaptation over time, changing the size and shape of those things. Best thing to do is to have the best setup. Right? So if I do work on a computer all day, every day, I want to make sure that I have that position where we're ideal. So sitting on the couch or doing it in our bed is probably not our best bed. Same thing with gamers. Even though we're really involved, we're really into it, we want to make sure that we're not hunched over our systems and that we have that good position, because if that's my career, that's my job, I'm doing that for 10 to 12 hours a day, I want to make sure I can keep doing it. So we want to make sure that we're getting that position in the best possible way so that we can continue to do those things. Let's see. Nurses and healthcare workers, they have an interesting situation. So they're split between two worlds. They're usually working on a computer for a lot of time. They're also running around like crazy, helping move and shift and transfer patients off of beds. So they have this really unique situation that they're relatively sedentary for a moment, and then they get up and they do something pretty intense. Making sure, even when we have those sedentary moments, we're filling out notes, we're doing all of our documentation. Every once in a while we get up, about every 30 to 45 minutes, we get up, we move around, we stretch, we do some movements. It's going to keep us warmed up for those moments that we do have to go use our body. Especially when we're lifting, the best positions when lifting or getting somebody to help you. We may be in a hurry, we may not want to take our time to get somebody to help us, but asking for help when we need it in those situations where we're moving